Welcome to the podcast where we discuss health, health span, lifespan, and longevity. I'm Dr. Noor Gajraj.
Hi, I'm Brandi Martin, and I'm here with Dr. Noor Gajraj, author of 100 Pathways to Longevity, Adding 25 Years to Your Life.
Yes.
Dr. Gajraj, let's just talk about you for a little bit.
Okay.
You've been in medicine for a very long time.
Yes.
What prompted you to write a book about longevity?
Well, I've been in medicine now for 40 years, which surprises me when I think about it. I am an anesthesiologist. I moved into treating patients with chronic pain. I also treat patients with addiction. I do treatments for weight loss, and also I've got more of an interest in longevity recently. I think there is an explosion in longevity. What we are seeing is that the number one risk factor for chronic diseases is aging. So if we can slow down the aging process, that would reduce or slow down the development of chronic disease. There are a few things to think about. There's, longevity is how long you live, but you also want to live healthily, and that's health span. So we want a long life, we want lifespan, but we also want health span. We want to be healthy when we're 90 or 100. So if we can look at the reasons rather than just treat the chronic diseases, will actually prevent a lot of chronic diseases. So that's what I'm interested in. I'm interested more in prevention and education, and really emphasizing the simple things that can increase your health and your longevity. So the main things that we see, which are pretty obvious, are number one, nutrition. There's an enormous number of books written on nutrition, literally hundreds. And it really boils down to a few principles. Number one, eat lean meats and fish. Try and stay away from red meat, highly processed meat in particular. Also fruits, vegetables, staying away from processed food. Pretty much all our food is processed now in the United States. It's about 90% ultra processed. So sadly, we probably have the worst food in the world because it's so highly processed. If you talk to people that come over here from France or Italy, they'll say, gosh, the food here is horrible, it makes me feel sick. And that's probably because of all the preservatives and colorings, additives, added sugar. Added sugar is a big one because we don't need added sugar in our diet. We get enough from natural foods, and we're only allowed, there's a limit to how much added sugar we can take. A lot of people don't know what the limits are. It's about 25 grams for females and about 40 grams for males. So if you start looking at packets, cans, the nutrition facts, you'll see there's a lot of added sugar in there, and it's very easy to exceed those limits. So nutrition's an important one. Also exercise. People ask me, well, how much do we have to exercise? There are guidelines. American Heart Association have produced guidelines. At least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week.
All right, so the subtitle says,
Yes.
Add 25 years to your life. That is a bold statement.
Right.
How realistic is that for most people? And then what does that really mean?
It's very possible. Most people will say, well, I've got bad genes, so I'm going to die early. But we have found that genes only account for 20 to 30% of your life expectancy. So 80% is lifestyle. So there's definitely room for improvement if we change our lifestyle. If you're smoking and you stop smoking, that'll add up to 10 years. If you're exercising, that can add another 5 years. Stress is a bad one for aging. So if we can reduce stress, that'll add another 2 to 5 years. If each of those just adds a little bit more to your life expectancy, that all adds up. But the main ones are nutrition, exercise, stress reduction, and also good relationships. Those are the main ones. And sleep. Sleep's very important.
Yeah, so out of all 100, you kind of just answered the next question.
Yeah.
Out of all 100, where would you start first? And it sounds like just a combination of those that you just mentioned.
Yeah, the
maybe.
combination of really the big five. You'll always hear nutrition, exercise, stress, sleep, and good relationships. That's really the core. Whenever we talk about a lot of stuff, gut health, brain health, you'll see those 5 things mentioned quite a bit.
What's one of the biggest myths about aging that just drives you crazy?
I would say that at the moment we're not able to stop aging or even reverse it in humans. There is some good research in animals, worms, mice, but we really don't have the data in humans yet. So people who talk about something that might slow aging or stop aging, those are just wild claims. So, and then there's the supplement industry, which is huge, and there are hundreds of supplements that are recommended, again with very little scientific evidence behind them. If I were to recommend some supplements, I would recommend vitamin D, omega-3 acids, coumarin, creatine, magnesium, probiotics and prebiotics. Those ones, I think there's some evidence behind. So those are the 2 ones that I would think about.
So from personal experience, with your own personal connection, of your own 100 pathways, which ones are really non-negotiable for your own life?
Well, I do a few things. I try and eat healthily. I avoid as much processed food as I can. That's extremely difficult. Every time you go into a grocery store, most of it's going to be ultra-processed. I do try and do the exercise guidelines. I don't smoke. I have cut back on alcohol. In fact, I stopped it. Yeah. Surprise, surprise. But, there was some talk about, a couple of glasses of wine is good for you, but actually it's been shown that there's no safe limit for alcohol. So 1, 2, even that's not good. And even 1 drink can interfere with your sleep. So, alcohol is, probably out, or at least avoid it as much as possible. I watch my weight. That's a risk factor for decreased lifespan. And I do take GP-1 agonist. That's helped a lot. There's some evidence that GLP-1 agonists are neuroprotective, maybe help with slowing down cognitive decline. With these drugs, there's also a reduction in fatty liver, and also there's some renal protective effects. Supplements, I take those ones that I mentioned. There are a couple of prescription drugs that have been found to help. Metformin I take intermittently, and there's a medication called rapamycin, which is probably the most promising medication for anti-aging. There have been some data from animals that show a lot of promise. But we don't have human studies for really any of these treatments. So if you think about, you would have to do a randomized controlled trial, the active treatment versus no treatment, and those would be very difficult to do. And then, of course, who would fund it? So,
Dr. Gajraj, beyond adding years, what is one thing that you hope that readers take away from this book?
I would like them to know that their genes are only responsible for 20 to 30% of their lifespan. Lifestyle factors are about 80%. So if you do, especially those 5 that I mentioned, that's going to add a lot of years. And then there are a whole list of other things that can add years. Stress, I mentioned, good relationships are very important. Bad relationships are going to be stressful and not good for you generally. Stress is bad. There are things like sauna and cryotherapy, and even drinking coffee has been shown to help. So many things. So in my book, you'll see so many things that you can do, and even if they all just give you a little bit, they'll add up.
Yeah. One of the things I like about your book is the way that you set up each one of the pathways. It starts with a really nice quote that kind of gets you thinking about the topic. It's a very easy read, a couple of pages for each topic, but then you leave them with a really deep thinking point. And at the end, of course, you have all of your references, which is a lot. It's very obvious you put a lot of work and research into this book, and I think that for picking it up before you go to bed or in the morning, it's just an easy read and it's a good layout for.
I'm interested in how medical knowledge can be delivered. I think a lot of books, even for me, are difficult to read. They're lengthy, and core information gets lost in a lot of pages. So for this, what I've done is made it to the point, easy to understand. You can probably read that book in a few hours. And yes, it's well referenced. There's more than 1,000 references, and that really reflects that everything that I have written does have some science behind it. A lot of books, a lot of things on YouTube are just assumptions, wild speculation. So I am proud of this book that, those pathways are legitimate and helpful to people.
Well, I appreciate that you took something so complex like cell biology and broke it into actionable points for your everyday person. Dr. Gajraj, out of all of the pathways in your book, if a patient or a person wanted to start today, what would be the first thing that you would recommend them take on?
Well, of course, the first thing we'll do is take a detailed history. Make sure that they've got a healthy lifestyle, because improving that can be very beneficial. And then, of course, physical exam. And I'm often asked, well, what about blood tests? What about these tests that tell you how old you are biologically versus what your actual age is chronologically? I do a lot of blood testing. We want to look at, for instance, hormones. Vitamin D is a hormone, very important. 70% of Americans are vitamin D deficient, so we want to measure that. Vitamin D has a lot of beneficial effects. Also, hormone balance, estrogen and testosterone. Testosterone is interesting because we don't just want a normal level for the patient's age, we want an optimal level. Let's say someone of my age might have a testosterone of 300-400. It might be within the normal range, but to be optimal, we like to get it up to 900-1,000. And the reason for that is, in terms of longevity, it's maintaining muscle mass. It's good for cognition. Obviously, it's going to the main reason a lot of people take it is for libido and energy. So it has a lot of beneficial effects. And then we're going to be looking really at thyroid gland or thyroid hormones are very important. So it's really a full evaluation. There are also telomere length. Telomeres are like caps on the end of the DNA, and the length of a telomere gets shorter with age. So we can measure telomere length. In fact, I had all my blood work done recently, and I'm 20 years younger than my chronological age. So that was good. And, some of these interventions can actually help with telomere length. It's been shown that lifestyle things can actually lengthen your telomeres. So, looking for imbalances. The body wants to be in balance, and unfortunately, there's a lot of imbalance.
Dr. Gajraj, in the types of patients that you're seeing, what is some advice that you're giving to them?
Well, I see a lot of patients with chronic diseases. They come to see me to have chronic pain treated, but they're overweight, they have osteoarthritis, heart disease, diabetes. So the first thing I look at as they're walking through the door, I can see how heavy they are. So I will discuss their weight, because being overweight is a risk factor for decreased lifespan. But smoking is a big one. I still see a lot of patients that, even though they've got terrible chronic disease, they're still smoking. And, if these patients stop smoking, they can potentially live 10 years longer, because smoking, as you know, is the number one risk factor for lung cancer. Yeah. And I think you've had some experience in that field.
Yeah. When is it too late to start on any of these actions?
It's never too late. It's been shown that even with exercise in patients over 60, it has a beneficial effect. I would say also stress, lowering chronic stress is going to help a lot. nutrition, of course. Developing social connection and relationships. All of these things can be very helpful at any age.
All right, so I read about the Blue Zone Project. Can you tell us more about that?
Yeah, this is a very interesting study. In fact, there was a Netflix documentary on it. So in the Blue Zone study, areas in the world with exceptionally old people were looked at to see what factors were contributing to their longevity. Those areas were Loma Linda in the United States, but also Sardinia, Costa Rica, Okinawa in Japan, and there were some similarities. Number one, they did natural exercises. So a lot of these people didn't go to the gym, but they were very active. They would sit on the floor and get up and do their cooking and their laundry and their walks. So they were always active. Mm-hmm. And that's important because at the moment in America, the average American is sedentary for like 7 to 8 hours. So that's very important. And they say like sitting is the new cancer. That's a little bit of a strong statement, but it does emphasize being active is very important, and having a purpose, something to wake up in the morning for, is very important. Connection, having the so-called having a tribe, having a group that you're comfortable with, even having go to a faith-based meeting, church, that can actually add 5 years to your life. Plant-based diet also. So we've got a lot of information from that study.
It's very interesting. Dr. Gajraj, there are hundreds of books out there on nutrition and active lifestyles. Why should someone choose this book over another? Like, what sets this apart?
Well, I've looked at 100 pathways. A lot of books are much less extensive, so it's very broad. I think I've covered most of the topics you'll see elsewhere. It's in one book. I haven't put anything in there that's just speculation. It's very well researched. I've got over 1,000 references, and it's very easy to read, so a reader can get that information very quickly, very easily, and very clearly.
Okay. Where could they pick up this book if they wanted to order it?
It's available at Amazon.
Again, this is Dr. Gajraj, 100 Pathways to Longevity, adding 25 years to your life.
Okay.
Thank you, Dr. Gajraj.
Thank you. Please subscribe to my channel and read my new book, 100 Pathways to Longevity, Add 25 Years to Your Life, available on Amazon.